Welcome to Local Discovery, a spotlight on health. It's the show that travels the country to find answers to how we can all live more healthy, active, stress-free lives. I'm Kristen Martin, and today I've returned to sunny Tallahassee, Florida to meet with the professional team of Tallahassee Memorial Healthcare. For the next half hour, I'll be quizzing the doctors, polling the nurses, and speaking with the patients to get the answers that you're looking for. From radio surgery and neonatal services to addiction treatment, diabetes management, and how state-of-the-art technology is helping to improve cancer treatment, plus so much more. If it will shine a spotlight on your healthcare concerns, you'll find it right here on Local Discovery, a spotlight on health. Today we're going to begin our visit right here at the newly opened Outpatient Cancer Center at One Healing Place. Focused on an atmosphere of hope and healing, this new center has a host of programs and services, an incredible team of professionals, and state-of-the-art technology that is advancing cancer treatment.
Well, our new cancer center opened in January of 2011, and it was designed to promote an environment of healing for our patients. We've had a long-standing affiliation with Moffitt Cancer Center between them and ourselves at TMH Cancer Center, and this allows us to provide clinical trials and other protocols that may not have been routinely available in the community.
Dr. Newman, I have to say that this beautiful new facility here, the Outpatient Cancer Center, is really quite impressive. Were you able to introduce some new services because of this facility?
We have, and once again, everything that we've done is with the patient's healing and promoting a healing environment in mind. Now we have new equipment that allows us to deliver more treatment more rapidly or more quickly during their therapy. We have the patient navigators, which are available to assist patients while they're undergoing treatment. We have a survivorship program that allows them to assist with the transition from undergoing treatment every day to returning back to their normal daily life. We also have a pet therapy program. We have board-certified physicians that have over 50 years of experience in radiation oncology, and just a wonderful staff.
Now, you did mention technology, and this piece of equipment behind us is, well, I don't even know what to call it. Tell me a little bit about the new technologies that you're able to use here at the Outpatient Center.
Well, but prior to this, we did have the standard complement of radiation therapies available. We had the external beam radiation, we had internal radiation with brachytherapy, which is used primarily for GYN implants or prostate seed implants, as well as stereotactic radiosurgery and some IMRT. Now with the new equipment, we're able to do much more accurate intensity modulated radiation, or IMRT, image-guided radiation therapy, and now with the Novalis, more stereotactic radiosurgery and stereotactic body radiation therapy.
Radiosurgery, or really stereotactic radiosurgery, is the use of focused radiation to treat some sort of a lesion or condition in the brain. It's typically an outpatient procedure for which the patients come in, lie on a table, have a short treatment of radiation, and then they go home. Radiosurgery is not surgery in that there is no cutting involved, there's no bleeding involved. It's strictly a procedure which is done by radiation through the skin, but there is no actual surgery being done. We can treat a lot of conditions with radiosurgery. The most commonly treated condition is cancer. We treat metastatic lesions to the brain, we treat primary tumors of the brain, and so the majority of what we do is the treatment of cancer. For patients, this is very convenient. What they really do is the patient now has all of the pre-treatment work done before they even arrive. They come in, basically they lie on a table, and the machine performs the radiation treatment, and then 30 minutes to an hour to maybe 2 hours later, if it's a very complex treatment, they get off the table and they go home. No incision, no scar, and no pain.
So are you finding that with the addition of all this new technology that the care for your patients is improved and you're seeing better response?
Oh, absolutely. We're finding that our patients' treatment times have been decreased Potentially with an IMRT previously, it could take 25 minutes, and this is given every day, 5 days a week for 6 to 7 weeks of treatment. Now with the new equipment, we can deliver the treatment in often 5 to 10 minutes, which definitely improves patient comfort and ease during their treatment. With the image guided and the IMRT, we're finding fewer side effects, and more accurate targeting, and potentially fewer complications. And then with the new Novalis and the radiosurgical equipment, we're able to offer therapies that simply weren't available in this region before. So we're very pleased and very happy to be able to offer these services for this community.
Medical advances are being made every day in the treatment of breast cancer. And now, thanks to the Breast Prosthesis Boutique located at A Woman's Place, breast cancer survivors and other patients of breast surgery can feel more confident and secure in their appearance than ever before. The Breast Prosthesis Boutique offers a private shopping experience with personalized service for women who have had a mastectomy or other breast surgery. The Breast Prosthesis Boutique carries a full line of breast forms, mastectomy bras, camisoles, and skincare products. And with a certified prosthetics fitter available to assist you with all your needs, you'll be sure to find the right solution the first time. From skincare lotions that are specially formulated for intensely dry skin that can result from cancer therapy, to undergarments that will help you to look great in your clothes, the Breast Prosthesis Boutique is helping breast cancer survivors look good and feel even better. For some cancer patients, the swelling of the arms or chest area can be an issue. This condition is called lymphedema, and it requires ongoing management and therapy. At Tallahassee Memorial Healthcare, you'll find specialized treatment with the only certified lymphedema therapist in the Big Bend region.
Lymphedema is caused by issues in the lymphatic system such as surgeries, trauma, or venous insufficiencies. Lymphedema can be treated by manual therapy with a physical therapist, and then you maintain it by wearing compression garments that will keep the swelling down in the arm. Other areas where we fit people with compression garments are lower extremity. We do knee highs, thigh highs, and full pantyhose as well. Lymphedema can be a lifelong condition, so you will want to wear your garments daily. Especially if you're going to be active doing gardening, exercise, or definitely flying, you'll want to wear your compression garments. Patients that have had a heart attack, stroke, diabetes, pregnancy-related swelling, or even wound care can benefit from compression garment therapy.
If you suffer from gastroesophageal reflux disease, more commonly known as acid reflux, well, you'll be very happy to hear that there is now a new procedure that's incisionless. It's relatively painless, it's very fast, and it's had incredible success. Dr. Crooms will explain more.
We have found a new procedure for gastroesophageal reflux disease. Gastroesophageal reflux is where the acid in our stomach comes up into our esophagus and maybe even up into our throat. All of us have that. There are patients that certainly are more symptomatic than the average person. And those patients end up being put on medication, and they're on medication for their entire life. We have always had surgical options for those patients, but those procedures have been done with either a large open incision, or in the past several years we've been able to do those procedures laparoscopically, which is a major benefit to the patient in regards to less pain and a faster recovery. What has also been developed over the last few years has been an incisionless fundoplication. That is where we actually go down your mouth with a lighted endoscope looking in your stomach, and then perform a fundoplication, which is a partial wrap of that area where the esophagus enters the stomach. In a laparoscopic or open procedure, we'll do a full 360-degree wrap in most cases, although in some we also still do a partial wrap. But endoscopically we are a little limited, and therefore we're only doing a 270-degree wrap. What our studies have shown us so far is that patients 80% of patients receive some benefit from this, either getting off of their medication entirely or being able to cut those down. It is done often as an outpatient. Many times those patients will spend one night in the hospital and then be discharged the following day and return to work within 2 to 3 days. We do ask patients to stay on a liquid to soft diet for 2 to 4 weeks, but eventually they're able to eat a standard regular diet, and hopefully will be off of all of those medications. We're the first ones to bring this to North Florida. and look forward to providing this service to our patients.
Did you know that an estimated 22 million Americans suffer from substance abuse or dependence? Well, luckily for Big Bend residents, Tallahassee Memorial has both the outpatient and the inpatient recovery centers. They're two very safe places where you can beat addiction and the emotional strains that accompany recovery.
At the Recovery Center, we provide both inpatient as well as outpatient recovery services, focusing in on detox in the acute phase as well as outpatient groups in our intensive outpatient substance abuse treatment program. Here at the Recovery Center, we view addiction as a complex medical illness. We focus in on treating not only the patient but the patient's family in their recovery process. Our recovery team is consisting of not only psychiatrists but therapists, social workers, and other members of the community, including AA and NA. Suboxone is a treatment that can be used in an inpatient setting for detoxification. It can also be used in an outpatient setting for maintenance treatment for opiate addiction. Here at the new Outpatient Recovery Center, we do offer outpatient individual as well as group therapy. Our intensive outpatient substance abuse treatment program is also housed here at the Outpatient Recovery Center. We also offer dialectical behavioral therapy, which is a specific form of therapy focused in on trauma for patients that are suffering from addiction as well as patients suffering from mental illness. Our team of psychiatrists, therapists, and social workers are well versed in treating both mental health issues as well as substance abuse issues. We do view that they do run hand in hand and often have to be treated independently. One of the things that is most rewarding about working at the Recovery Center is seeing people on a daily basis make changes in their lives, both within their families as well as integrating themselves into society. We see this here at the Recovery Center on a daily basis, and it's very encouraging to come to work and see people do as well as they've been doing.
You can beat addiction with the professional help available right here at the Recovery Center. We always anticipate the healthy birth of a child. However, complications can occur, and it's during these times that you want the most up-to-date technology and the very best neonatal team available, and you want them at a moment's notice. Jessica, why are technology and speed so important when we're talking about neonatal services?
Well, we have seen that technology has significantly reduced the mortality rate in this special population over the past 20 to 30 years. And when you're dealing with a patient population ranging from less than a pound to 10 pounds, technology and speed are critical.
And what types of complications are you able to treat right here in this facility?
We're able to treat complications of preterm delivery, unforeseen complications during delivery, sepsis, minor surgeries, congenital malformations. We have everyone from nurses, respiratory therapists, nurse practitioners, doctors, and subspecialists that we consult, such as pediatric cardiologists, neurologists, ophthalmologists, and general surgery as well.
We've been treated very good. The nurses here have been very friendly. They've helped us, they've asked us if everything's fine, explained every procedure. Been real encouragement to us, letting us know that other parents have been through this before and that everything's worked out good for them, and it's really been an encouragement being here every day.
What types of services can the parents and the babies expect to find here at the neonatal ICU?
We have a Ronald McDonald house where they can stay if they're from far away. We have a Ronald McDonald room where they can be in the hospital but not in the unit. And we have a music therapy program where music therapy works with the babies that are learning to feed and are growing. We have social services available, and we have a bereavement program available to parents who have had a loss or are expecting a loss.
Now, this is the only neonatal ICU in this area. Do you think that sets you apart?
Absolutely, it does. As a matter of fact, we are the only neonatal ICU in the area in this region, and there are multiple surrounding counties that we transport in from.
Do you feel like very fulfilled at the end of each day?
I am. It's great. We actually had a baby come in 3 days ago on Friday, and she had been here for a long time, and we got to see her healthy with no tubes, no wires, and just growing, and you never know she was here, but she was here for a long time.
Admitting a child into the hospital can be scary for the child as well as the parent. So to gain a first-hand perspective on the type of treatment you can expect to receive at the pediatric ICU, I'm going to be talking with Amy and Emily. Hi guys, how are you doing today?
Good.
Good, so do you mind sharing with me the circumstances that led you having to check Emily into the pediatric ICU?
Emily was about 5 months old. She stopped breathing. We live about 20 minutes from here. By the time the ambulance got to us and put us into the ER, She had stabilized. We got up to the PICU, or the pediatric floor, and at that time, within an hour, she stopped breathing again. So she was rushed over to the ICU, pediatrics, where Dr. Truman evaluated her and basically got her stabilized.
I knew I wanted to be a physician when I was 18 and volunteered on an ambulance and actually got to work with patients firsthand. Pediatric critical care physicians treat critically ill and injured children, whether they're in a car accident, fall out of a tree, anything that leads them for their life to be in danger. Those are the patients that we treat. I mean, to treat critically ill children, it's best done with a team. It's important to have a pediatric critical care nurse, a physician, a child life specialist that can all come together and give the child what they need, each coming from a different perspective. But it really helps support the family and support the patient. One of the benefits of having a pediatric critical care unit locally is that the families can stay with their children, and it just is much easier on their families, because often the children are only in the intensive care unit 2 or 3 days, and then they're usually better enough to go out to our pediatric floor or even go home.
We didn't know what to expect. Whenever they came in and took Emily back, the team and Dr. Truman, they took her back, got her stabilized, and was able to come out and make us feel comfortable knowing that they were there taking care of her. We didn't have anything to worry about. We were still very scared, but a lot more relieved to know that she was okay. They made me feel very comfortable, just knowing that they are watching her and making sure she has everything she needs.
If you've ever seen your child poked and prodded in search of a good vein for a successful lab draw or IV start, you'll be very happy to hear that medical advances have really taken the guesswork out of vein location, and it's all thanks to the Vein Viewer. The Vein Viewer allows healthcare professionals to clearly see accessible veins directly on the surface of the skin. The technology utilizes near-infrared light, a digital video camera, and an image processing unit to build an image of the patient's vasculature. The device then projects the image in real time onto the patient's skin using visible light and a digital projector. The Vein Viewer image is intuitive and the vessels are easy to recognize. When you combine the technology of the Vein Viewer with the comfort of Buzzy, a pain distraction device adored by children of all ages, you're able to decrease the comfort for patients and stress for their families, increasing overall patient satisfaction. If you've never heard of a child life specialist, you'll want to pay special attention to what Kendall Monday has to say, because in my opinion, the role that she plays in a child's hospital experience is absolutely invaluable. Hi, Kendall.
Hi.
So what exactly is a child life specialist?
A child life specialist is someone who reduces the stress and the anxiety of children and their families in a hospital setting.
Okay, now how exactly do you go about accomplishing that goal?
Normal play is probably one of the most important things to do. Providing that sense of normalcy is important. We also provide therapeutic activities. We also do pre-procedural preparations, and I also help assist patients through preparations.
Now, this is obviously a very child-focused area. Is all of your work done here, or do you actually go out into pediatrics as well?
We go out into pediatrics. We have the new treatment room that we just finished, so we do a lot of our procedures in the new treatment room. So I'm on the floor and in the playroom as well. I'm able to help the families and the patients with coping and provide them with those play opportunities, which is extremely important for their development and growth in the hospital.
And what ages are you working with?
I'm working with infants all the way to patients that are 18 years old, so there's a wide range.
Now, I understand that the philosophy here in pediatrics is very family-focused, family-centered. Do you think your role adds to that?
I think so, definitely. When working with patients, it's definitely important to incorporate the family, because nobody knows the patient better than mom or dad or whoever the caretaker may be. So their opinion and their insight is definitely valuable for everybody here in pediatrics.
And is it ever just play, just for fun?
It is play. There will be days when we close down the playroom and turn it into a movie room and pop popcorn or decorate cookies just because. So normal play opportunities are extremely important for pediatric patients and their siblings also.
Great, thank you so much, Kendall.
Thank
I'll let you get back to the kids.
Thank you so much.
Tallahassee Memorial Healthcare is very proud to offer a designated Level 2 trauma center. So to learn more about what that means for Big Bend residents, I'm meeting up with Patty Statler. She's the Trauma Program Manager. Hi, Patty.
Hi.
So I understand getting this designation is really quite difficult. What led to going through these different hoops?
In 2005, a study was produced by the University of Florida, and they showed that the morbidity and mortality was very high in our region, which means death rates were high. So from the study, TMH said in 2006, we need to do something about this. So we began the process of becoming a trauma center. July 1st, 2009, we accomplished that mission. We became a Level 2 trauma center.
And how does that translate into the care given to the patients of this area?
When you go to a trauma center, you have optimum care. You have specially trained physicians and nurses, and the equipment is there, and everything is on hold for this trauma patient. So you get optimum care.
Now, is there a difference between an emergency center and a trauma center?
When you have an accident or something on scene, they call, the EMS comes and takes you to the hospital. If you're a trauma alert, we get a phone call and say, I have a trauma alert. I have a such and such age person and I'm bringing with this injury. All the team begins, they all get the page at that time and they become aware and ready to take care of you. So when you arrive, everyone is ready to take care of you and you are priority one.
The trauma designation is for all comers, so all forms of trauma. In our specific region, that includes the majority of blunt trauma, meaning car accidents and sports injuries, but also includes penetrating trauma, so things like gunshot wounds and stabbings and impalements, unfortunately, also occur, and we're equipped to handle all of those. The trauma center designation allows us as ER physicians to work very closely with our trauma surgeons. And having trauma surgeons on staff and available to us 24 hours a day allows us to provide very rapid care for our trauma patients and progress them to the operating room if necessary in a very short period of time, which is something that most hospitals are not able to do.
We are designated for 10 county region. We now see patients from 36 counties, so that tells you that's significant. Also, with the death rates that were so high initially, we now compete statewide.
Diabetes affects more than 25 million people of all ages. That's 8.3% of the United States population. So to learn more about this disease, I'm meeting up with Dr. Deeb right here in the Diabetes Center. Hi, Dr. Deeb.
Good morning. How are you?
Do you mind? I'm very well. Do you mind if I take a few minutes of your time?
Please.
So what exactly is diabetes and how does someone know if they're at risk?
Well, diabetes is a condition that affects blood sugar. And when it gets high enough, we call it diabetes because it can kill you, make you go blind, destroy your kidneys, cause you to have heart attacks. And people at risk for diabetes include people of minority races, people who have family members who have had diabetes, and certainly people who get overweight.
Okay, now is there a large difference between type 1 and type 2 diabetes?
Well, type 2 diabetes is in that group that I just described. Type 1 diabetes comes along because the pancreas is destroyed. The cells that make insulin are destroyed. And so it's really a very different disease. It requires insulin to survive.
All right, now is diabetes preventable?
Yes and no. Certainly, if you fit those groups, being active, controlling your weight, exercising every day, we've shown you can reduce diabetes dramatically. However, not completely.
All right, now I keep hearing more and more about pediatric diabetes. Is this a growing area of concern?
Well, diabetes in children is increasing worldwide at 3% a year. And if you're younger than 5, new diabetes cases are increasing at 5% a year.
At the hospital, they were great. We didn't even have to go check in at the main entrance. They met us up on the pediatric floor and just had the room waiting for Haley and, got there, and then our Dr. Deeb came in and told Haley, you're ready to give yourself a shot. You've got diabetes. So within 5 minutes of meeting him, Haley had given her first shot, and she's given all of them since then.
I didn't know a clue about diabetes. I'd never heard of it, and so when they're like diabetes, what's that? I thought it wasn't like a big deal. You didn't have to give yourself 8 shots a day, so I was very shocked and scared too. Well, before every meal, I have to check my blood sugar, and then I calculate my carbohydrates, and I dose it all up, which tells me how much to dose, and I give myself a shot, and I do that around 8 times a day.
I'm asking you to measure your blood sugar several times a day. Think about what you eat every time you eat. Give insulin if you have type 1 diabetes or medications. The complexity of that is immense. You can't do it by yourself. You need a team. You need to learn how. And when you do, you can be successful.
From the Diabetes Center, we're going to head over to Tallahassee Memorial's Heart and Vascular Center so we can learn a little bit more about how modern technology is helping to advance patient care. Let's go. There is an approach to blocked arteries and angiograms that is pleasing both doctors and patients alike. It's called a cardiac radial catheterization, and by entering through the wrist instead of the groin, the patient may experience less pain, is mobile more quickly, and can expect a 65% reduction in bleeding complications. Here to tell us more are Dr. Katapodis and Dr. Noel.
We started doing cardiac catheterization through the wrist back in 2001. Because the wrist artery is more easily accessible and it has far less complications. And the patients can literally sit up after a couple of hours from doing the procedure and have their lunch. And it's far more comfortable, it's safer, and patients really like it. And in fact, when patients hear that we can do the cardiac cath from the wrist, if they've had them from the groin, they ask to get it done through the wrist. And now we've actually turned out to be one of the leading sites in the United States doing wrist access angioplasty and cardiac catheterization. In fact, we saw some statistics that we were in the 99th percentile across the United States of sites that do cardiac catheterizations and angioplasty through the wrist.
It was very, very easy. There was no pain and had no discomfort whatsoever. With this procedure they did now, it's I'm up, and if I wanted, I could be up moving around very easily.
A radial cardiac catheterization is where we actually place a catheter in the right radial artery, typically, that's in the right forearm. The catheter tracks up within the radial artery, and we're able to place that into the coronary arteries that supply blood flow to the heart, and then evaluate the coronary arteries for significant blockages. Well, the benefits compared to a femoral approach are that the easeability for the patient to be able to be supine quickly and then stand up very quickly after the procedure. Patients seem to really appreciate that. There's less tenderness and pain after the procedure, and you're able to return to your daily activities much faster. Clearly, radial artery approaches are first choice, and I think they are going forward in the 21st century. Physicians have been really excited about it, and because of such good patient feedback, we propagated this and provide it to the majority of our patients when possible.
Well, that's all the time that we have today. But if we must wrap up the show, I have to say that closing in this beautiful healing garden in the new Outpatient Cancer Center is really the perfect note to end on. Now, before I go, I would like to thank the many professionals that took time out of their busy schedules to meet with us today and answer our questions. I know I'm feeling better prepared about my healthcare options, and I hope that you are too. Now, if you'd like more information on the subjects that we covered today, you can go to the Tallahassee Memorial Healthcare website. It's tmh.org. Or if you'd like to review any or all of the program you've just seen, go to our website. It's localdiscovery.tv. Just click on the Spotlight for Health button. I'm Kristen Martin. I'm off in search of more answers to how we can all live healthier, more active lives. Thank you so much for watching this edition of Local Discovery, a Spotlight on Health.